Welcome to Nurs 241. Today we are going to look at assessment of growth and development part 2. Last week we looked at assessment of growth and development part 1. How do you know if a child is developing well is a question. This can be assessed using developmental milestone. Developmental milestone is an ability that is accomplished by children at a certain age. Developmental milestones are used to assess a child's learning ability, skill, behavior, and developmental levels. These milestones will be examined in this session. So basically, this is what we are going to look at in this session. We'll look at developmental assessments, definition of developmental milestones, and major developmental milestones for infants. That's the reading list. So developmental assessment, I said earlier on that we can use developmental milestones to assess for development. Denver Developmental Screening Test, and this test is designed for children up to 6 years of age. And what does it do? It measures gross motor, fine motor, language, and personal social development. So with that, you'll be able to assess whether the child is developing. You can also use the age stages questionnaire. It is also designed for children between birth to 5 years. Then it measures development of communication, gross motor, fine motor, problem solving, and personal skills. So these are basically some of the ways that you can assess development in a child. What is developmental milestone? Developmental milestone is an ability or skill that is accomplished by most children at a certain age. We'll look at major developmental milestones for infants. We're going to look at the gross motor skills, but before that, let's look at what it is. It refers to skills involving stabilization of the head, the trunk, the limbs, postural control, and the use of the large proximal muscles. It also involves control of the child over his body. So that is what is termed as gross motor skills. Let's look at gross motor skills for an infant. What do you see? At 6 to 8 weeks, the child is able to raise the head to about 45 degrees. Remember in our previous lecture, I said that the pattern is from head to toe. So at 6, you realize that the child is able to raise the head. So the head can be raised first before the limbs or the body. At 3 months, the child rolls over. Then at 4 months, the child lifts his head and anterior part of the chest to 90 degrees. 5 months, the child sits with support. For 6 months, the child will sit with round back. Some children sit very early. Some also sit very late. At 7 months, the child sits alone with straight back. At 8 to 9 months, the child crawls. Somebody told me that the child started crawling around 7 months. Yeah, there's no problem with that. At 1 year, the child stands alone and walks with somebody holding the hand. Some children can stand alone around maybe 1 year, 3 months, 1 year, 4 months. But we are worried when the child is about 18 months and the child can't stand alone. You need to educate the mother to seek for medical intervention. So we'll look at the fine motor skills. This includes hand and eye coordination and skill for manipulating skills that you can manipulate with the hands. That is fine motor skills. So at 1 month, what can you see? The child can actually hold hand in a fist. The child follows objects with the eye. As the object is moved to one direction, you see the child following the moving object. At 3 months, the child can also hold a rattle firmly on the hand. Sometimes you are trying to pull it and it's so difficult. At 4 months, the child plays with the hands. Then at 6 months, the child can pass cubes from one hand to the other hand. So you can move it from the left hand to the other one. Sometimes the child holds the feet and pulls it to the mouth. At 8 to 10 months, the child can eat food. We have high chairs for infants. So when you chop food into pieces and you put the child in the chair, the child will be able to eat herself. At 10 to 12 months, the infant claps the hand and waves bye-bye. Language skills. For crying is the infant's first communication, and the sounds are all the same at first. Yeah, so when the child is born, the first communication is that it cries, and the sound is the same. At 1 month, you can actually differentiate between the cries of the baby. At 3 months, child turns head to look for voices. So when they hear a voice in the room, they will just turn their head to the direction of the voice, and sound, gargles, and laughs are loud. So they gurgle and you hear them laughing aloud. At 4 months, the bubbles are 6 to 8 months. They recognize their own name and respond by looking. Still on language skills, at 8 to 10 months, the child can make some sound. The child understands words like no and bye-bye. They respond to their name. They can imitate the sound of others. At 1 year, the child can say mama, dada, or associate meaning to sound. Some of them, around 7 months, 8 months, they are able to say mama or dada. Let's look at the personal social skills. At 1 week, they watch mothers attentively. At 6 to 8 weeks, there's a social smile. When you smile at them, they smile back. At 4, they love and enjoys other people. They laugh and so. At 5 to 6 months, infant cries when parent leaves. Then 6 months, they extend their arms to parent to be picked up. At 7 months, they imitate others' action. At 9 months, they imitate sound. And 10 months, they wave bye-bye. From 6 to 10 months, the lower central incisors also appear, and this may result in increased drooling and irritability. At 9 to 13 months, the lateral incisors. Psychosocial skills. So that is why I ask you people to read on the theories of growth and development. We are going to apply the theories here. So at this stage, the child, if you had read, I'm sure you appreciate this particular slide. So developing trust. So according to Erickson's theory, the infant acquires trust if his needs are constantly met. It means that if the child needs something and start crying and is not attended to, the child will grow up in a way that he will not trust people. But if his needs are constantly met, then the child can develop trust. According to Freud, infant's first year is considered the oral stage. So around this period, the infant takes pleasure in routine, suckling, and eating. After teething, additional oral gratification comes through biting. So they have pleasure in the mouth. They can also suck their tongue, the nipple, fingers, toes, or toys. Anything that they see goes to the mouth. Piaget also says that the infant will be in the sensorimotor stage, which actually extends to 2 years. The infant also develop object permanence. What is object permanence? That is the realization that an object beyond his immediate view still exists, and it starts developing around 9 to 12 months. At 3 months, they prefer visual stimuli of mobiles. They enjoy looking into the mirror, that's their play. Then they also enjoy auditory stimuli such as tape players and soft music. So when they are in the room, you can open the tape for them to enjoy. At 3 to 6 months, they prefer soft noise. They like moving objects such as rattles. They also enjoy soft toys with different colors. At 6 to 9 months, they like the teething toys. They also like socializing with other children and adults. Their temperament. Each individual has a unique behavioral style, and that affects all aspects of developmental growth and care. For example, a child can be considered as a difficult child. So if a child is considered a difficult child, what does it mean? The child likes schedule feeding and structured caregiving. Some of them also distract. But for those of them who distract, they respond well to soothing actions such as stroking and rocking and swinging. So you sing for them and you rock them and they are okay. And some of them are hyperactive. For such people, they have an increased need for motor activity and needs to be watched carefully to prevent home accidents. Today we have been looking at developmental milestones for an infant. Thank you.